The clinical assessment of articulation and phonology. The CAP is a norm reference test designed to assess articulation and phonology in school-age children from age 2 years 6 months to the age 8 years and 11 months. The purpose of the CAP is to inventory the articulation abilities of young children and look at their overall articulatory competency, estimate the occurrence of 10 common phonological process patterns in children's speech, and to compare word and sentence level competence of school-age children. The CAP test comes with several items, including the examiner's manual, the stimulus easel, 5 CAP pals, the sticker pack, the articulation inventory record form, the phonological process checklist 1 and 2, and the tote bag. The consonant inventory consists of 44 words. There are 27 simple words, 8 cluster and blend words, and 9 syllable words. The consonant sounds are assessed multiple times in various positions in the 44 words, for a total of 97 test items. The consonant inventory targets prevocalic and postvocalic sounds, selected cluster words composed of common sounds, familiar multisyllabic words containing 3 or 4 syllables, and selected postvocalic word productions. The school-age sentences for clients ages 5 years to 8 years 11 months target articulation accuracy in sentences that vary in length and complexity. In sentences, accuracy is measured according to the number of words produced correctly. There are 8 sentences varying in length from 8 to 11 words for a total of 73 words. The articulation inventory record form contains 4 pages. Page 1 is used for identifying information and presenting all of the scores. Page 2 and 3 then provide space to record responses to the consonant inventory and features a table to summarize the client's speech sound inventory. Page 4 contains the scoring areas for the school-age sentences, a consonant singleton index, and a norms table for all consonant sounds and the schwa plus r sound. The phonological process record form contains 6 pages. Checklist 1 analyzes the client's phonological process patterns based on how he or she responds to the words in the consonant inventory. Checklist 2 is used along with the phonological probe section of the stimulus manual. Each of these checklists uses a yes or no response. The CAP uses a checklist approach to assess the percentage of occurrence of 10 common phonological processes. The CAP includes 10 short word probes contained on checklist 1 and 2 to assess the percentage of occurrences of these processes. There are 3 syllable structure processes, 5 substitution processes, and 2 assimilation processes. The phonological processes tested are cluster reduction, final consonant deletion, syllable reduction, substitution processes, gliding, vocalization, fronting, deaffrication, stopping, prevocalic voicing, and postvocalic voicing. The 2 checklists evaluate the same phonological processes. Clinicians decide whether to use the checklist 1 or 2 based on the severity of the client's phonological disorder. Emma is a 5-year, 2-month-old female who is the product of a healthy, complication-free pregnancy. At 1 year and 2 months of age, Emma was hospitalized with bacterial meningitis. After a follow-up 1 month later with an audiologist, Emma was diagnosed with moderate bilateral sensorineural hearing loss. At 1 year, 8 months of age, Emma received hearing aids and her mother reports that she wears them most of the time. Emma was referred for a speech and language evaluation by her audiologist, who thinks that her hearing loss is impacting her language development. He reported that she is having difficulties with consonant cluster reduction, final consonant deletion, deaffrication, and prevocalic voicing. Emma has no siblings, and English is the only language spoken at her home. Both of her parents are hearing. Language delay due to hearing impairment can manifest in many different ways. Typical symptomology can include delays in both receptive and expressive language skills, decreased complexity of sentence structures, as well as decreased vocabulary. A language deficit can cause learning difficulties, impacting the child's academic achievements. Difficulty understanding and following directions. Children with hearing loss present with disordered development of all 5 components of language. But the phonological systems of children with hearing loss are most susceptible to distortion. Phonological systems among children with hearing loss are typically consistent and have similar predictable disturbances. Characteristic speech disturbances include breathy phonation, narrow pitch range, excessive nasality of vowels and consonants, and distorted articulation. With the diagnosis of moderate bilateral sensorineural hearing loss, we would expect that Emma would present predominantly with phonological difficulties due to her audiologist referral noting disturbances with her phonological processes, in addition to the fact that, among all the aspects of spoken language, phonological skills are most often susceptible to disruption as a result of hearing loss. The most common phonological error patterns in children with hearing impairment are final consonant deletion, cluster reduction, liquid simplification, deaffrication, voicing, and stridency deletion. With the diagnosis of hearing loss, the clinician would also expect a client to present with difficulties understanding and following directions. The clinician should also expect delays in receptive and expressive language development, including low vocabulary, decreased complexity of sentence structures.
This is Elba, and this is Mac. Elba is the happiest elephant in the jungle because she and Mac are best friends. Elba and Mac are always together. They eat together, they play together, they even go fishing together. And after a long day, they rest together. Some days, Elba and Mac look at books together. Mac likes to point to the pictures and say what he sees. Elba loves to listen. Mac says, "That's a train, and that's a fire truck." Elba and Mac want you to be their friend and look at some pictures with them. After you look at each picture, you say what you see. Elba and Mac will listen to you. What is this?
Duck.
What is this?
Shoe.
You're doing a great job. Let's look at some more. I'll show you a picture and you say what you see. What is this?
Pig.
What is this?
Bed.
What are these?
Teeth.
What is this?
Dog.
What is this?
Cage.
What is this?
Date.
What is this?
Mouse.
What is this?
Knife.
You did a great job saying all the words. Now let's say some words in a row. Say all the words I say. The monkey measures the temperature with a thermometer.
The monkey measures the temperature with a thermometer.
Say all the words I say. The turtle reads a story about swimming with alligators.
The turtle reads a story about swimming with alligators.
Say all the words I say. The parrot loves to swing on the trapeze.
The parrot loves to swing on the trapeze.
Say all the words I say. The mouse walks on the high wire above the crowd.
The mouse walks on the high wire above the crowd.
Say all the words I say. The elephant and her friends do tricks in the center ring.
The elephant and her friends do tricks in the center ring.
Now let's look at some pictures you've already seen. There are a few pictures on each page. Let's start here. What is this?
Pig.
What is this?
Bed.
What is this?
Cage.
What is this?
Hive.
What is this?
Fist.
What is this?
Seep.
What is this?
Sheaves.
What is this?
Rake.
What is this?
Leaf.
What is this?
Web.
The norming process involves taking samples that represent the population. They are picked based on geographic location, socioeconomic status, age, race, and gender. The norm example for the CAP is made up of 1,668 children between the ages of 2 years 6 months and 8 years 11 months. 1,576 are from the United States and 92 are from Canada. The children were not receiving speech and language services at the time of the test. 10 subjects were excluded because they were showing speech and language deficits. The standardization sample was based on the United States Census in 2000. Children from the South were slightly undersampled. There are more females than males. This was minimal and represents the population. Whites and Hispanics were undersampled under 5 years of age. African Americans greater than 5 years of age were oversampled. Socioeconomic status was based on the mother's educational level. More children came from homes where the mother's education level exceeded high school. The language spoken at home resembles Spanish-speaking homes, but English-speaking homes are oversampled. The sample was based on children 2 years 6 months to 8 years 11 months. It would be inappropriate to evaluate somebody whose cognitive level was not in that age range. The CAP is a valid test because it thoroughly explains all areas that it purports to assess. Its results were also compared to a well-established test called the Banks-Bernthal Test of Phonology, the BBTOP. Both tests assessed 10 phonological processes. The results of the two tests had a strong correlation. The CAP also has good content validity because it uses appropriate items, it has a complete item sample, and it thoroughly assesses the content. The test was originally performed on 1,707 children between the ages of 2 years 6 months and 8 years 11 months. The standardization version consisted of 63 consonant singleton words, 18 cluster words, 13 multisyllabic words, 15 preschool sentences, and 15 school-age sentences. All standardization stimuli were well organized and easy to use. With these high reliability coefficients, it is difficult to find any danger zones of the CAP. The only danger possible is if one judge finds the child to have high intelligibility due to familiarity, while a different judge thinks the child presents with low intelligibility due to unfamiliarity.